afternoon everyone. We are live today from Sakra World Hospital, Bangalore. We have with us our expert Dr. Ashok, a senior consultant of ENT, head neck surgery, to discuss all your queries on neck swelling. Good afternoon, doctor.
Good afternoon, Hema.
Doctor, here are a few questions from our followers on neck swelling. Doctor, shall we start?
Yeah, sure.
Why we need to address a neck swelling?
Good afternoon, everybody. Today we are talking about neck swellings. So why we should be concerned about a neck swelling? So any swelling, when you say, it is an extra growth or a bulge which is seen in the neck. So this can be due to multiple reasons. It can be just an infection like a throat infection or tonsillitis. Sometimes we will have dental infection which will cause a swelling in the neck. So that is trivial. Once you treat the tonsillitis or pharyngitis or dental infection, that swelling will settle down. But sometimes we can have swellings which are persistent for longer time, like when we have tumors in the thyroid gland or any cancer which is there that can cause swelling. Sometimes even children are born with some swelling. So these are additional growth which are there. So there can be a wide variety of reasons why a swelling will come. So if a swelling is there for a longer time, if it is not causing pain, then you have to be much more cautious about it because it can be cancerous, especially in elderly people. And also who are smokers, alcoholics or chewing tobacco, they have to be very, very cautious about a neck swelling.
What are the causes of neck swelling?
So like I said, depending upon the age, there can be a wide variety of conditions. So if a child, a neonate, has a swelling, it can be a congenital defect. Later on, when a child has that, during an acute infection, it can be tonsillitis, or in children we find adenoid growth also. That is like tonsils at the back of the nose, there will be a swelling which causes neck swelling. So this is the most common cause in a child. As we grow older, we find that in the midline, when a child is having an extra swelling, it can be related to a thyroid or what you know as called as a thyroglossal cyst. That is also a congenital condition where there is fluid collection and which causes like a balloon-like swelling in the neck. And in elderly, it can be cancer, it can be salivary gland tumors, salivary gland stones. It can be cancer of the thyroid, the cancer of the oral cavity, voice box. Multiple reasons are there.
Okay. My next question is, what is acute lymphadenitis?
So when we talk about lymphadenitis, means there is a network of structure caused due to some lymphatic tissue. So these lymph tissues, they are the protective mechanism in the body. So they'll pick up the microorganism, the bacteria or even cancerous cells, and they drain into a protective structure known as a lymph node. And when there's infection into that, it's called as an acute lymphadenitis. So when you have throat infection, we find a swelling in the neck. So that means the body is good, has a good immune structure and system which is cleansing the bacteria from the body. So this acute lymphadenitis can be treated with antibiotics. So when you take medications, they kill the bacteria and then the lymph node which is swollen will settle down.
Okay.
So that is a condition known as acute lymphadenitis.
Okay. What is lymph node biopsy, doctor?
Okay, so in this lymph node itself, when there are chronic infections, or if you find that the lymph node is swollen for a longer time and the lymph node keep on increasing in size, then we need to find out why exactly this lymph node is swelling up. So we take a sample from that lymph node, and to take a sample for it to test what it is, like a biochemical test or a histopathological test. Histopathology means we are checking that tissue which is removed from the lymph node to check for bacteria, for cancer. So that is known as a biopsy. So there's a test where we put in a needle withdraw a few drops of blood from that and test it. That is known as a fine needle aspiration cytology, or FNAC, what it called. So that is one form of biopsy. And if you want little more tissue, we pass in a bigger needle. That's called a core biopsy. So we pass in that core needle, that's a bigger needle, and one small thin strip of tissue comes out. That we test it in the pathology lab and we'll find out what exactly it is. So these are the different types of biopsies which we do. Sometimes we remove the whole lymph node and test it. So that's known as a lymph node excision biopsy, where exactly it will give us the diagnosis of whether it is an infection, whether it's a tumor, whether it's cancer. So these are the different forms of biopsies which we do.
Okay. My next question is, what is lymphadenopathy cause?
Okay, so lymphadenopathy means the lymph nodes are enlarged for longer time.
Okay.
It's not just an infection. Like in acute lymphadenitis, you'll have a painful swelling in the neck and it will be tender along with the fever. But when the lymph nodes are enlarged and it appears like a extra growth and it won't be painful, it will be enlarged for longer time, then we call it as a lymphadenopathy. And Cox lymphadenopathy means it is a TB lymph node infection. So TB is very common in India. So we can pick up that infection when our immunity drops. If we have illness which is there for long or vitamin deficiencies, we are not healthy, then we pick up these infections which are there in our surrounding, or people who have elders in the home who had previous infections. So the bacteria will be there in our body and which will flare up when our immunity comes down. And also healthcare workers, we being in the hospital for throughout our day and for many years, we pick up these TB infections. So these infections will be lodged in the lymph node and then the lymph node starts growing up. So here we'll have to identify what exactly is there, why this lymph node is swollen up. So for FNAC of these lymph nodes will guide us to find out whether the TB bacteria is there. That's called an acid fast bacilli, AFB what we call. So we can identify that in the lymph node, or there are certain blood tests also which we do, like CBC to see whether the complete blood count, to look for the changes in the blood picture. ESR is erythrocyte sedimentation rate. That also increases with TB. Sometimes you can have lung TB and which causes these lymph nodes to swell up. So X-ray chest will also guide us. So if a lymph node is swollen and is persistent for long, in our scenario we should check out or rule out TB. Okay. So that is Cox lymphadenopathy, what we call.
Okay. Doctor, can cancers affect lymph node?
Yeah. So lymph nodes, when it's swollen, first we'll have to rule out whether there's infection. The second cause would be cancer.
Okay.
Specifically, people who smoke, chew tobacco, alcoholics, or in an elderly, we have to first rule out whether there's cancer. Even children also can have cancer.
Okay.
So cancer in the lymph node, there's a different set of cancerous lesions, like what you call lymphoma, which is a cancer of the lymph nodes itself. So lymphoma can affect. So here there are different tests which we do, like a biopsy, and there are other blood tests and also clinical examination which will lead us to the diagnosis. So we have seen if we have oral cancer, tongue cancer, so the lymph nodes in the neck also will get swollen up. So we should not neglect when we have a swelling which is persistent for longer and we don't have pain in it. Pain usually indicates it's an infection and can be easily treated with antibiotic. But if it's not painful and if it's growing in size, it is an alarming sign and it has to be sorted out.
Okay. Can cancers affect lymph node? How do you differentiate what are cancer lymph node?
Okay. So like when you're talking about the biopsy for the Cox lymphadenitis, The same thing can be done for the lymph nodes when it is cancerous also. So when you're doing these biopsies, FNACs, core biopsies, we'll find malignant cells in that. So in that malignant cells also we can differentiate whether it is from the lining from inside the mouth, is it a skin related cancer, whether it's coming from the salivary glands. Sometimes it can be from the nose and sinuses also you can have cancer. So these cells are totally different depending upon the site from where it originates. That will lead us to the diagnosis, or when we look directly into the nose, into the throat, we can find ulcers or swelling or some non-healing changes which are there. Sometimes tooth also becomes loose, or there can be some dental pain. That has to be probed and looked into, and if there's a lesion, an ulcer, we'll have to take a biopsy. So we can correlate the oral lesion with the lymph node. So like that we can differentiate different malignancies by looking at the lesion also and doing a biopsy from the lymph node.
Okay. What are different levels of lymph nodes?
Okay. So in the neck when we see, there are different groups of lymph nodes. Like when we talk about lymphatics, like I earlier told, lymphatics are like a meshwork of protective tubes, like arteries and veins which carry blood in the body. Like that, venous system is for the impure blood and arterial system is for the pure blood. Like that, the lymphatic system has lymph. That's another set of channels which carry lymph. Lymph is mainly immune cells are there, and they pick up all the bacteria and these loose cells. If cancer is there or anything abnormal in the body, they usually help to clear it. Like it's a protective mechanism of the body. So these protective mechanism will remove these bacteria and viruses and fungus, everything from the body, like cleansing mechanism. So that passes through these lymphatic channels, and then the station is the lymph node. So they all collect in the lymph nodes. And then the lymph nodes will be swollen, and when we diagnose that as an infection, accordingly we treat, whether it's bacterial treatment, whether it's fungal treatment, whether it is cancer treatment. Like that we differentiate. So this lymphatic system also has a pattern to it. Like from the oral cavity, it will just go to the station under the jaw. That is a submandibular gland area where the lymph nodes will be stationed. So that is level 1 area. So then in the neck, at the deeper part of the neck also, there are 3 levels, upper part, mid, lower. So from the dental part, it can go to the level 2 lymph nodes. If it is a thyroid lesion, it goes to level 3. So the thyroid gland is little lower down. So adjacent to it, whatever lymph nodes are there, that gets swollen. And lower down, it will go to level 4. If it is extensive from these stations, it will go to the back of the neck. So that is level 5. So like that, different stations of lymph nodes are there. So we know depending upon which side the lymph nodes are swollen, so which area the pathology is, what disease is there. So that also leads us to diagnose what is wrong with the body.
Okay. My next question is, what are salivary tumors?
Okay. So salivary glands are saliva producing glands in the body. So we have 3 main salivary glands. What is known as a submandibular gland, which is under the tongue. A parotid is in front of the ear. So we have bilateral, one on the right and left. Submandibular also is a paired gland, and sublingual glands are there. Sublingual is just under the tongue, adjacent to the submandibular gland. So these are the 3 major salivary glands, and also we have small minor salivary glands all throughout the mouth and tongue area. So these salivary glands also can have tumors. It can be from the saliva secreting area, from the tubes which are there inside the salivary tumors, salivary glands. So these will form extra growth, and that also will present as a swelling. So in elderly, we find these salivary gland tumors coming up. So the treatment of that depends upon what type of tumor arises. So we have to do an FNAC and diagnose it. Sometimes even stones can produce swellings. So salivary duct has calculi formation or stone formation, which will block the duct and will form a swelling. And this swelling usually it increases when we're eating, because the saliva formation will increase and the stone will block the duct, so the saliva doesn't come into the mouth and the swelling increases. So when a neck swelling is there, which is adjacent to the salivary gland or onto the salivary gland, we'll have to rule out whether it's a tumor, where there is a duct blockage due to stricture, or whether it's stone formation, and then accordingly diagnose the treatment.
Okay. Can you explain about mumps?
So mumps means an infection of the parotid salivary gland, which is in front of the ear and which goes a little below the ear. So viral infection of this parotid gland is known as mumps. So usually it starts as one-sided swelling and then it can go to the other side also. So mumps, usually the person will have swelling in front of the ear and going below the ear, and it persists for 4-5 days usually. So there will be some upper respiratory infection like a cold and cough or throat pain, followed by the swelling. So usually the swelling is self-limiting, it will settle on its own, because these viral infections are tackled by the immune process in the body. So it will settle on its own, and children usually get this, but now when you are giving mumps vaccine regularly and it's controlled as such. But adults also, sometimes if you have not been immunized, we can develop mumps again. And especially during summer months, we find more of mumps coming in. That's the season when these viruses are more. And also it is communicable. Like one person has this infection, it can go to another person also. We can pick up those infections.
Okay.
So hydration is very important. We should drink a lot of water. Oral hygiene should be good so that the virus doesn't spread from the oral cavity into that parotid gland. And if the person has fever and pain, we have to give painkillers and also control the fever with paracetamol and other medications.
Okay. So what you will suggest for this summer season also, sir?
We have to hydrate ourselves well.
Okay.
We'll have to drink a lot of water. Don't allow our mouth to dry up. Keep on sipping water. And also eat citrus fruits.
Okay.
Have lime juice, that will increase the salivary formation. So there's no blockage or collection of bacteria, viruses in the mouth. So it drains out and then you don't pick up infections.
So I have one more doubt, doctor. Can patients, those who are suffering from tonsils, so can they have lime juice and all?
Not during an acute attack.
Okay.
When an acute infection is there, we should avoid citrus things. That can sometimes aggravate if you have an allergic tendency or a susceptibility to catch cold.
Okay.
So during an acute attack, when you have throat pain, fever and all, it's better to avoid that.
Okay.
But otherwise it shouldn't be a problem. We can have.
Okay. So thank you, doctor, for your valuable insights.
Thank you.
Thank you, viewers, for joining us. If you have any query, you can leave a comment and our expert will answer them for you. Thank you, doctor.
Thank you, everybody. Thank you.